What do you think needs to be done by leaders to help build a sustainable system?
That's the question in Canada and now in America, in the United States, that's been going on. I think in America, ever since the GDP was being eaten up by healthcare costs, that question has been going on. And in Canada, as we have socialized medicine here, this all question is, are we able to deliver excellence with, this kind of sense of, in a way, it's homogenizing us, or it's not giving us enough innovation, or the burden is bigger than we can possibly even address. So in some ways, first of all, I want to answer the question by kind of giving two or three very important, vivid things. When Biden came in with his presidency, he did an incredible thing by saying we're going to have 100 million vaccines in 100 days. It was a clear strategy, and it actually helped the starting of the healing of America, which was an amazing thing to see. And I love that he did that, because at the time he's 78 years old. So leadership is not restricted to age. Came in with a very clear strategy. And I think we are hungry for what is a compelling strategy that is going to energize people, that is needed. I don't have the answer to it, but I do think whether it's the healing, creating, certainly there's different populations now that we know that need more care, and that we know need better attending, and that we know right now the figure that's really clear in the world that everybody knows needs support is healthcare. Healthcare is the sector now that's become more important than retail, more important even, Bezos just went off into space, not Bezos and Branson, but even more than space. I think if we don't have our health, then we can't go into space. So I think that as a brand, as a sector, is even more important. But I think for us, we also need to recognize the tremendous burden that we're in. It's not true in America, in Canada, the way it's true in America, but in America, what healthcare is suffering from is a litigious environment. It's just absolutely, that's one of the tremendous factors. The other thing is this expectations of healthcare is like you can't succeed. So while longevity has increased until recently in America, the idea of healthcare is it's just been so unappreciated and not really enough gratitude that actually burnout now, certainly among physicians, is the highest of all professions. And when you look at that, and burnout in nurses is also there. Non-well-being issues are very pervasive. So we need to ask ourselves, really, we need to collect more data, collect information. And here's what I think, Kurt Lewin was the father of social psychology and a tremendous thinker. And Lewin would just say, gather the information in the field. If there's anything, we don't need more experts. We need to be listening to each other and say, what is hard about this? I think that we need large system change, and we need to listen to the different groups that are delivering the care and that are bearing the burden and having the burnout. Because it's actually very painful. And when we hear these stories, I had a family member that went to an urgent care center here in Ontario and was turned away because they said, well, you just have a little stomachache, no problem. And he went home and his gallbladder burst. The rest of the story of this person is actually not good. And I kept always revisiting that and saying, how did they let a thing like that happen? Because it's such a minor thing when you think about it. Very small procedure. It could have had the next day, he could have been home. And what ended up happening to this person was so not good. And you think, where was the compassion? Where was the concern? And you trace it back and you say, okay, was there an investigation about what they needed to learn from that? So in a way, we probably need a pause, and we need an analysis of all of this. Is where do we start? And do we have a commitment? Maybe we need a summit on healthcare, that we start gathering data and we come together. We have technology for large system change. We have these concepts that are exciting, open space, where we get everyone involved, everyone talking. We get all the data. We have these wonderful people like Otto Scharmer listen to the whole field, gather the old field, and let's see the data that is emerging. When we have this amount of chaos, it means that no one has the answer, but everyone together can create an answer. And I think we also have so much brilliance in healthcare. You know, I look at the people you've been interviewing, and in each one I go, you know, I get dazzled. And I think maybe we all just need to listen together, you know, like a year project, pause, reflect, you know, the terms that now are very exciting in my world. Have a reflective inquiry, gather the data, listen to each other, maybe some homework, come together in a month. What are we going to do with it? And then where do we want to start changing or making things happen? If anything, you know, with this COVID that has happened, we could have gotten the data early on to our decision makers and done better at making it more efficient. Instead, we turned into a little bit police state when we didn't have to. We spent money on that. We could have gone earlier to the vaccines, and it was reasonable. It wasn't, but somehow the lines of communication stopped. So less criticism, but also support. Can we give more support? Can we come together? Can we have a better plan that involves, you know, all the voices? You know, there's a movement everywhere in the world now called diversity, equity, and inclusion. Very wonderful. But diversity means hearing everyone. Equity, giving that airtime and really including, you know, radical thinking. Maybe there had to be, you know, the most radical thinker go away for a day, come back and surprise us. We have to do that. You know, in 9/11, the disaster, we never know from that again. One of the things that I heard was that it was the CIA, or it was a certain kind of division that invited science fiction writers for a meeting. And they said, what's the most radical thing that you can think of that we didn't shock us, that we weren't thinking? Because Thomas Friedman, he had a wonderful line for America. He said, the real problem was not that we couldn't think, but that we had a crisis of imagination. And we have to imagine together, what is it possible that we will need? Like nobody could even now imagine, you know, well, we seem to do quite well on Zoom. What are we going to do with all those buildings now in hybrid? How can we, you know, in New York, they're having a crisis because very expensive real estate, right? How can we come up with an intelligent idea of using the space, maybe jobbing it out in a particular way? I mean, this would not be easy, but in a way that people will get better quality of time with their family. They will show up for work for certain meetings, maybe rent out the space for different possibilities, maybe healthcare clinics for a certain day, you know, something. So I come back, maybe that the answer is, we have excellent large system change technology.